What if I told you that the way you've been touching yourself for decades, the grip, the pace, the way you chase the finish, could now be quietly damaging your body? After 60, what once felt good can slowly reduce your sensitivity, strain your circulation, and even affect your confidence, all without you realizing it. I've seen men lose pleasure not because they aged, but because no one ever told them they needed to adapt. I'm Dr. Mohit Khera, a board-certified urologist and men's health specialist. For more than 30 years, I've helped men in their 60s, 70s, and beyond stay healthy, sexually confident, and fully connected to their bodies. I'm not here to judge. I'm here to give you the facts and the solutions that actually work. Here's the paradox. The habits you perfected in your youth, the ones you've trusted for decades, can now work against you. It's not your fault, it's biology. Your body has changed, and your technique needs to change with it. In this conversation, I'm going to show you exactly how to adapt your self-pleasure routine so it's safer, more comfortable, and more satisfying than you thought possible after 60. You'll learn how to protect your skin, boost your sensitivity, and keep your erections healthy. And when it's time to talk to a doctor, and stay with me until the end, because I'm going to reveal one surprising habit during self-touch that can silently affect your prostate health. Something most men never hear about until it's too late. Before we get started, if you haven't already, make sure to subscribe and turn on the notification bell so you don't miss any future men's health advice tailored for you. And if you find this video helpful, type 1 in the comments. If not, type 0, and tell me how I can make it even better for you. Now, let's begin with the first thing every man over 60 needs to understand before making any changes: how your body actually shifts with age. Because once you know what's happening inside, every adjustment you make will feel more natural, more effective, and far more rewarding. 1. Understanding how your body changes after 60. When I sit across from a patient in his 60s or 70s, I can almost always see the same frustration in his eyes before he even says a word. He leans in, lowers his voice, and tells me something along the lines of, "It just doesn't feel the same anymore, doc." And here's the first truth I share with him. Your body hasn't failed you. It's simply evolved. The shifts you're experiencing are part of a natural process, not a sign that you've lost your masculinity or your ability to enjoy pleasure. After 60, testosterone levels, the very hormone that fuels desire, mood, and performance, tend to decline. That doesn't mean you won't feel arousal. It just means it may not spark as spontaneously as it used to. You may need more time, more touch, or even just a different mental space to get there. At the same time, the blood vessels that supply your penis lose a bit of their flexibility. They don't open up quite as quickly or as fully as they did decades ago. This is why erections can take longer to develop or may feel softer, particularly when you're alone and relaxed. And then there's the nervous system. The nerve endings that once fired off signals instantly may now whisper instead of shout. Sensations arrive, but more slowly, more subtly, requiring a little more patience to fully appreciate them. When you put all of these changes together, the habits you built in your 20s and 30s, the grip, the speed, the single-minded push toward climax may not serve you anymore. In fact, they might even work against you, leaving you feeling frustrated, disconnected, or wondering if something is wrong, but nothing is wrong. What's happening is that your body is inviting you to play by new rules. And when you learn those rules, you unlock a kind of satisfaction that can be deeper and more mindful than anything you've experienced before. So now that you understand the changes taking place, let's talk about the common mistakes most men make, mistakes that can quietly chip away at your pleasure, and how to avoid every single one of them. 2. The 5 most common mistakes men over 60 make. Over the years, I've listened to countless men describe their routines in the same way they might describe an old, trusted tool. "I've been doing it this way for 40 years, doc. Why change what works?" The truth is, what worked before may not only be less effective now, but it can also work against you in ways you don't notice until the damage is already done. These mistakes are common, and I see them every week in my practice. The first is using the same grip strength you've always used. In your younger years, a firm hold might have been the quickest route to climax, but after 60, thinner skin and more delicate blood vessels make that same pressure risky. Over time, it can bruise small vessels, numb nerve endings, and actually reduce your ability to respond. The second is going too fast too soon. Your nervous system isn't firing at the same rapid pace it once did. When you start out quickly, your brain doesn't have enough time to fully register each sensation. You might think you're building pleasure, but in reality, you're rushing past it. The third mistake is skipping lubrication. Too many men think lube is unnecessary if they're alone, but after 60, reduced testosterone often means less natural moisture in the skin. Friction without lubrication can lead to microtears, irritation, and soreness that lingers long after. The fourth is forcing climax, as if reaching the finish line as fast as possible is the only measure of success. Pushing for orgasm under pressure triggers stress hormones, which can actually shut down your ability to enjoy the moment. And the fifth is ignoring what your body is telling you. Many men operate on autopilot, repeating the same motions without stopping to notice whether they still feel good. But when you learn to respond to your body instead of simply repeating old habits, you begin to reconnect in a deeper way. If you recognize yourself in any of these, you're not alone. The good news is, each of these habits can be replaced with something better. And in the next part, I'll walk you through the exact steps of a safer, more satisfying technique designed specifically for the man you are today. 3. The safe, adapted technique. After 60. When a man in his 60s sits in my office and tells me that self-pleasure has become frustrating, I often see the same pattern. He's still using the approach that worked decades ago. Same pace, same pressure, same order of touch, and he's wondering why it doesn't feel as satisfying anymore. The truth is, after 60, your body asks for something different. It asks for patience, for gentleness, and for a kind of presence you might never have given it before. The first step is to choose your time wisely. Give yourself a window when you won't be rushed or interrupted, at least 15 to 20 minutes where your mind can let go of the day. If your nervous system feels rushed or on guard, your body will never fully open to pleasure. Set the environment in a way that signals relaxation. That might be dimming the lights, putting on soft music, or even warming the room slightly. Small comforts tell your brain, "I'm safe, I can let go." Before you touch yourself, take 5 slow breaths in through your nose and out through your mouth. This is more than a formality. It slows your heart rate, opens blood vessels, and prepares your body to receive sensation. Apply lubricant early, not as an afterthought. Gently spread it across the entire genital area, letting your hands linger. Let the warmth, the glide, and the awareness be part of the process, not just a setup for what comes next. Begin with slow, exploratory touches. Think of this as a massage, not a sprint. Notice which angles, pressures, and rhythms feel best. Pause when you want to, breathe deeply, and allow yourself to enjoy without focusing solely on climax. This might feel unfamiliar at first, but once you adapt, you'll find it opens a door to deeper satisfaction than you've felt in years. And speaking of unlocking more pleasure, there's one overlooked factor that can transform your experience even further, and it has everything to do with the way you position your body. 4. Positioning matters more than you think. Most men never consider how their posture or position might affect their experience. They think pleasure is all about the hands, the movement, the touch. But after 60, the way you position your body can be the difference between feeling fully engaged and barely feeling anything at all. I've seen men come into my office convinced that their sensitivity is gone, only to realize that the problem wasn't their nerves. It was the way they were sitting. When you're seated on a hard chair, leaning forward, or hunching over, you may be unknowingly compressing the nerves and blood vessels in your pelvic region. That pressure can limit blood flow and reduce sensation, making everything feel muted. It's not that your body isn't capable. It's that you're creating physical roadblocks without realizing it. Instead, try reclining with good support behind your back so your pelvis stays open and relaxed. Some men find lying on their side with a pillow between their knees allows them to feel more comfortable and connected. Others benefit from elevating their legs slightly, which improves circulation and takes pressure off the lower back. There are also supportive tools designed for this stage of life: warming sleeves, textured aids, or soft materials that provide stimulation without excessive force. I tell my patients to think of these the same way they'd think about wearing reading glasses or using a supportive chair. It's not about weakness, it's about working with your body instead of against it. Small changes in positioning can make a big difference in how you experience pleasure, often more than speed or technique alone. And when you combine the right position with the adapted approach we discussed earlier, you give your body every chance to respond at its best. But technique and position are only part of the story. The real breakthrough often comes when you change something less obvious. Not how you move your body, but how you think about the entire experience. And that's where we're heading next. 5. Shifting your mindset. One of the biggest changes I see in men after 60 has nothing to do with blood flow or hormones. It's about mindset. Too many men approach self-pleasure with the same mental script they had decades ago, that it's about performance, speed, and reaching the finish line as quickly as possible. But the truth is, after 60, the most fulfilling experiences come when you let go of those old rules. I've had patients tell me they feel frustrated if they don't climax, or if it takes longer than it used to. They see this as a sign of decline, when in reality, it's just a different rhythm. Your body is asking you to slow down, to notice the smaller details, to find pleasure in the process instead of racing toward the end. When you release that pressure to perform, you also release the tension that shuts pleasure down. Self-pleasure at this stage of life becomes less about proving something and more about connecting. It's about exploring what feels good now, in this moment, with the body you have today. It's about giving yourself permission to pause, to change direction, or even to stop entirely if you feel satisfied before orgasm. That's not failure, that's awareness. And here's something most men don't realize. Your emotional state plays a direct role in your physical response. Anxiety, frustration, or self-criticism can block the very pathways that create arousal. But when you approach self-touch with curiosity, patience, and self-respect, you create the conditions for your body to respond more fully. The goal is to shift from performance mode to connection mode. And when that shift happens, you'll often find that your experiences become richer, more satisfying, and more meaningful than they were in your youth. But even with the right mindset, there are times when changes in your body signal something more serious. And knowing when to seek help can make all the difference. That's exactly what we'll talk about next. 6. When to seek medical help. Even when you do everything right, you slow down, you adapt your technique, you choose the right position, you shift your mindset. There are times when your body may be telling you it needs professional attention, and ignoring those signals can make a small, easily treated issue turn into something far more difficult to manage. I tell my patients all the time, the smartest, strongest men are the ones who know when to ask for help. If you experience persistent pain or discomfort during or after self-touch, it's worth paying attention. A mild burning sensation, unusual dryness, or lingering soreness that doesn't improve with lubrication and gentler technique can point to inflammation, infection, or irritation of the delicate tissues. These are usually treatable, but the longer they go unaddressed, the more likely they are to cause ongoing problems. Sudden or significant numbness is another warning sign. It's true that sensation can gradually fade with age, but if you notice a sharp drop or a dead zone of feeling, it could mean there's a nerve issue that needs to be evaluated early. The sooner you act, the better your chances of protecting your sensitivity. If you find yourself unable to get or maintain an erection even in calm, private, and relaxed settings, it's not a sign that you've lost your masculinity. It's often a vascular or hormonal issue, both of which can be managed once properly diagnosed. And finally, don't ignore emotional distress linked to self-care. Feelings of shame, anxiety, or frustration can interfere with sexual function just as much as physical problems. Talking to a doctor can help you address both sides, the physical and the emotional. When you recognize these signs and take action, you're not giving up control, you're taking it back. And speaking of control, there's one final perspective that can completely change the way you view self-pleasure after 60, making it not only safe, but deeply rewarding. That's where we'll go next. 7. Final takeaway. After 60, self-pleasure is no longer just a physical act. It's a dialogue between you and your body. It's an opportunity to listen more closely, to respond with care, and to honor the changes you've lived through instead of resisting them. Too many men approach this stage of life with a sense of loss, convinced that pleasure must inevitably fade. But the truth is, it doesn't have to. In fact, for many men, pleasure after 60 becomes deeper, more mindful, and more connected than it ever was before. When you loosen your grip, both physically and mentally, you remove barriers that have been quietly dulling your experience. When you slow your pace, you give your nerves and your blood vessels the time they need to respond fully. When you choose comfort over performance, you create space for sensations to build naturally, without pressure or strain. And when you let go of outdated definitions of success, you open the door to new kinds of satisfaction, ones that don't depend solely on climax, but on the quality of the journey itself. This isn't about going back to the way things were in your 20s. It's about moving forward into a phase where pleasure is supported by wisdom, patience, and self-awareness. Your body is not broken, it's evolving, and you deserve to evolve with it. Every adjustment you make, from technique to mindset, is an investment in your long-term sexual health and your confidence. You are teaching yourself how to thrive in the body you have now, and that's a skill that will serve you for the rest of your life. But there's one more thing you need to know. Even with the right technique, there's a habit during self-touch that can quietly affect your prostate health, especially if you do it regularly. Most men don't realize it until it's too late. And in the conclusion, I'm going to tell you exactly what it is and how to protect yourself. Conclusion. If there's one message I hope you take away from this, it's that pleasure after 60 is not only possible, it can be richer, more meaningful, and more satisfying than you ever imagined. Over the years, I've sat with countless men who came in worried, convinced that their best days were behind them. I've watched their expressions change as they learned that their bodies weren't failing. They were simply asking for a new approach. You've heard how your body changes with age, why old habits might not serve you anymore, and how a few simple adjustments in technique, pace, positioning, and mindset can open the door to a completely different experience. You now know the warning signs that tell you it's time to see a doctor, and you've seen that seeking help isn't weakness, it's taking control of your health. The truth is, you've earned the right to enjoy this stage of life without pressure, without shame, and without fear. Your body is still capable of pleasure, connection, and intimacy. It simply thrives under new rules. So, take the time, make the adjustments. Give yourself permission to explore in a way that honors who you are now. And before we end, remember what I promised you. There's one overlooked habit during self-touch that can quietly affect your prostate health. It's something most men never think about, but it can make all the difference. Let's talk about it right now.